This is the Anchorage Emergency Operations Center operational update for 9 June. Situation, go ahead.
Good morning. Today is day 462 of our response. As currently reported locally, we have 35 cases in the last report a week ago, 0 deaths and 2 hospitalizations. And statewide, up 141 cases, 0 deaths and 15 hospitalizations. For 213 resource requests, we filled or otherwise satisfied 1,763. That's an additional 8 since the last report, with 26 currently working. In our congregate shelter, there are 328 clients, down 52 from the last report. In the non-congregate shelters, 341 clients, up 2, at 669 clients. In all shelters, down 50, averaging 2,007 meals served per day. In the past 7 days at the visit testing sites, there are 2,078 sample collections performed. And in the last 7 days at the visit vaccine sites, all pods, there are 2,116 doses administered with 75,516 to date. End report.
Thank you, Situation. Next up, weather.
Good morning. This is the weather. Before you have the PowerPoint, and so far for the remaining of this morning, we're anticipating sprinkles, which will continue to diminish into the noontime. So drying out is expected by the afternoon. For the rest of this week, we're anticipating showers back by Sunday, so a good chance for showers is expected Sunday. In regards to our mostly sunny days, we are definitely looking forward to that, starting Thursday through Saturday. With the strong winds today and tonight, mainly along the Turnagain Arm and the higher elevations. Winds there are from the southeast, 25 to at least 40 miles per hour for today, and then 20 to 35 miles per hour tonight. Again, that's for mainly the Turnagain Arm and the higher elevations. For the remaining of the next couple of days, light and variable winds are expected, especially for this morning, and then becoming south winds 10 to 20 by this afternoon, and then by Thursday, Friday, it'll be mainly light and variable, especially over the Anchorage Bowl. And so far, that's what we have from the Weather Service.
Thank you, weather. Testings, vaccinations, go ahead.
Good morning, everybody. This is Pat Ryder, Emerging Infectious Diseases Assistant Program Manager. Today with testing, Visit Healthcare reported a decrease of 5.2% over the previous week's sample collections. As of June 8th, our estimated daily growth rate is a decrease of 5.11%. Our 14-day average reproductive rate is 0.765, trending downward and staying below 1. And our 14-day average case rate is 3.16 for every 100,000 people in the population. Our current alert level is low. Positivity rates and case numbers are continuing to decrease. With vaccines, Visit Healthcare had an increase in daily average vaccinations of 60% from the previous week. Our vaccination clinic at the Shiloh Missionary Baptist Church will be closing June 18th. Our vaccination clinic at the Alaska Airlines Center will be closing on June 30th. We are currently seeking a new and larger site. For pop-up vaccine clinics this week, on Thursday we have Mountain View Library. Friday we have the Writers Block, Fifth Avenue Mall, and Cartier Field Softball Tournament. On Saturday we have Kabbalah's Cookout, Spirit of Muldoon Picnic, Mountain View Boys and Girls Club in Cartier Fields. Sunday we have Hotel Ayahuasca offering free Ram tickets. On Monday we have the Beartooth, and on Tuesday we have King Street Brewing. Just a reminder to anyone who wants a mobile vaccine clinic to come to you, whether you are a business, church, or other organization. For more information or to schedule, please dial 907-531-5100. Next slide, please. So our overall risk level has moved to the border between the lower risk and considerable risk categories, trending downwards. With regards to messaging, our average daily new case count has decreased below 5 cases for every 100,000 people. With over 51% of the eligible public, ages 12 and above, having completed the vaccination series, Anchorage currently has 2 subpopulations with separate risk profiles. Unvaccinated individuals experience a risk of COVID-19 infection equivalent to 9 out of every 100,000 people. whereas vaccinated individuals are equivalent to 1 out of every 100,000. With fewer restrictions, individuals, especially unvaccinated individuals, need to assess their own risk and act accordingly. For other additional contributing factors, there remains limited demand for vaccines despite an increase in eligibility. There is also an increase of transmissible variants, while we are seeing decreasing case counts across the state. This concludes testing of vaccines. Barring any questions, end of report.
Thank you, testing and vaccines. Mass Care, go ahead.
Good morning. This is Sean Hayes, Mass Care Branch Chief. So we have 4 projected discharges today, 15 projected in the next week. As everyone sees, we are seeing a decrease in numbers at the Sullivan Arena. Our team continues to expand our non-congregate shelter to support Sullivan Arena demobilization, and at the same time decompressing our non-congregate sites by housing our folks who are employed and have income. End of report.
Thank you, Mass Care. Contracts and logistics, go ahead.
Good morning. This is Wendy Reese reporting for Contracts and Logistics. For Mass Care support, we have summer sheltering contract extensions keyed up with Purchasing Office to be presented to the Anchorage Assembly on June 22nd for decisions. Lessons learned for future demobilization actions. We're just keeping those in line. For testing and vaccine, from the logistics standpoint, there's really not much to report there. We're just supporting the new and enduring requirements. Staffing, new extensions for 19 personnel. There's 19 of those and 3 that are new. Realigning positions with adding personnel as necessary. End of report.
Thank you, contracts and logistics. Finance, go ahead.
Good morning. This is Audrey Jo Malone reporting for Finance. As of today, there are $17,423,817 in current encumbrances. The actuals spent to date is $60,565,219, with a total expenditure to date of $77,989,37. Please continue to submit invoices and supporting documentation to eocinvoices@anchorageak.gov. Over.
Thank you, Finance. Up next, safety.
Good morning, everyone. This is Public Works Safety Officer Aaron Carter filling in for Annalisa Roberts. We are in week 2 of National Safety Month, of which the topic is COVID-19 safety concerns, especially in regards to the workplace. The National Safety Council has released several resources to address employees returning to the office from remote work. These resources include Safety Plus Health, the Safety First blog, the 8 Trends for the Future World of Work infographic, and Safe Actions for Employee Returns resources. To access these and many more, please visit nsc.org. Thank you very much. Have a safe day. End of report.
Thank you, safety. Public information, go ahead.
Hi, folks. This is Heather Arono, Public Information Officer for the EOC. So we are continuing our outreach to local businesses about hosting pop-up clinics. Working on promoting 4 clinics that are already taking place. Mentioned a little bit earlier in this meeting, focusing on Alaska Rock Gym and Mountain View Library, and then rest of those on that list. I really appreciate how welcoming and encouraging everyone has been on trying to get more businesses in touch with our team so that we can get these signed up. We are sharing flyers, translations about testing and vaccine appointments to the larger community. We are keeping track of information for the federal government's announced month of action for increasing vaccinations through the month of June, and we'll be determining appropriate course of action to take locally. And promoting the Juneteenth celebration that we are partnering with Northway Mall and the Juneteenth Committee on that event. That'll be at Northway Mall parking lot on June 19th. We'll have a vaccination clinic. There will be food, there will be music, there will be lots of vendors out there with booths. It's a family-friendly event. Encourage everybody to come out. And also just want to put in a plug for free rides available to get a vaccine. So if you know somebody that is having trouble getting a ride, just note that Uber and Lyft are offering rides to and from vaccination clinics, or Anchor Rides is also an option for those in Anchorage 60 and older. So if anybody has any information about that or needs any information about that, go to your Uber or Lyft app or contact Anchor Rides. End of report.
Thank you, Public Information. Up next, Liaison. Go ahead.
Good morning. This is Celeste Prescott, Liaison Officer for the Anchorage EOC. Thanks to all our partners who are able to join us today. And we'll go ahead and start off with Tracy with Matsu Borough EOC.
Hi, this week the Matsu Borough EOC is supporting Public Health Nursing Clinic at Palmer's Friday Flings. Appointments available through covid19.alaska.gov. Thank you, and end report.
Thank you, Tracy. And before we move on to hospitals, do we have any other partners who would like to report out this morning? Okay, hearing none, we'll move right into the hospitals. And Kirsten with Alaska Native Medical Center was not able to join us today, but she was very happy to report out that zeros across the board. No COVID patients, which is great to hear. And I believe Sean has joined us with Alaska Regional Hospital.
Good morning, Alaska Regional Hospital. We don't have zero, but we have 3 COVID patients. 2 of them are in ICU, both of them are on vents, and we have no PUIs.
Well, great, Sean. That's good to hear. Your numbers are dropping as well. And I believe Nikki is on with Providence Alaska Medical Center.
Yes, good morning. Today we have 5 COVID positive patients, 2 in ICU, none on mechanical ventilation, and 2 COVID recovered. Thank you.
Thank you, Nikki. And I believe Kara is on with Matsu Regional Medical Center.
Good morning, Kara Cahill with Matsu Regional Medical Center. We currently have 2 inpatients, none in the ICU, none on vents, and no PUIs. Thank you.
Thank you, Kara. Good to hear all those numbers dropping. And was Sergeant Perez or anyone else able to join us today from the 673rd Medical Group? All right, sounds like he wasn't able to join us. If I get those numbers later, I will be sure to include them with the email with the slides. And that's all for Liaison. Thank you.
Thank you, Liaison. As a reminder, our next operational update brief will be June 16th at 10 a.m. Everybody have a great day.